Hey folks, welcome to our first ever Rural Voices show, part of the TN Rural Caucus. My name is Chase, your moderator for this evening. Now, before we dive into our discussion at hand, I want to make sure you know everyone that's joining us. So, in no particular order or anything else, the first person you're going to hear from tonight is Gordon Bonnyman. He's the co-founder of the Tennessee Justice Center. Thanks for being here, Gordon.
Hey, Chase, thank you. And I'm glad to be here. And let me just say that, as Chase said, I work for a nonprofit. We're a 501c3, which means we can't take partisan political positions, but I'm glad to be here and get an opportunity to interact with folks and talk about rural health, which of course affects all of us regardless of how we vote or who we support.
Next up, you'll hear from Andrea Bon Johnson. She's the candidate for State House District 82nd and the CEO of Golden Circle Insurance Agency. Andrea, thanks for being here.
Thank you, Chase, for inviting me, and I'm looking forward to a very informative discussion tonight.
We've also got Amber Riddle, a progressive rural organizer and candidate for State Senate 4th District, here with us tonight. Amber, sorry, thanks for being here.
Yeah, thank you guys for having me on here. I'm glad to be here with everyone.
And last but certainly not least, in any sense of the meaning, Sheila Younglove, a family lawyer and candidate for State Senate 16th District. Sheila, thanks.
Hey, thanks for having me on here. I'm excited to get to discuss healthcare, and so glad that we have these other esteemed people here to speak with us and to enlighten us regarding healthcare in Tennessee.
Thanks. So, Andrea, we're going to start with you because you were sharing a story earlier about your brother and your son, both parents having COVID, and you're in a very rural district. So you've got a very good view on the ground of what healthcare looks like in a rural community. What are you hearing when you're out talking to people? What's top of mind for them when it comes to healthcare?
Well, first of all, as you mentioned, both of my parents were diagnosed with COVID. My brother and my son both tested positive for COVID. And the night that my mom passed out at home, at the time we did not know she had COVID, but she passed out at home, and ordinarily the hospital would have been 5 minutes from us. But when we called the ambulance came, they saw how sick she was. They had to take her to the helicopter and airlift her to Jackson, Tennessee. They knew how sick she was. They knew they had to get her to an emergency room as quickly as possible. And so I was just thinking about how so many people have these dire emergencies. And now we have to wait and get taken to Jackson, Tennessee. We have no emergency facility in Haywood County at all. And so I hear this story throughout Haywood County. We have to wait for the ambulance to come. And oftentimes the ambulance is our emergency room. The back of the ambulance is an emergency room for many of us here in Haywood County. So we miss our hospital. We need a emergency facility, at least an emergency facility here that can take care of needs like that.
Now, Sheila, you're in a pretty rural community too, just right over next door to me here. When you're out talking to folks over in the 16th district, like what are you hearing?
I'm hearing a lot of the same concerns, because I believe I have the largest geographical district in the state Senate, and it includes some very rural districts. For instance, Grundy County is just now getting like a fast-paced, walk-in clinic. There's no hospital there. Sequatchie County has got, some medical facilities, but not a tertiary care center. And you're having this same thing of not having immediate access to quality health care simply because of the distance involved. And you have people that are worried more than ever now because of COVID that they won't be able to get care as quickly as they need it if they do start to have some of the more severe symptoms. I believe I had told you guys that I had COVID a few weeks ago, and I would not have even realized it. I felt fatigued, but otherwise I wouldn't have realized it if a coworker's husband hadn't tested positive, and then we had to all go get tested. I thought it was just campaign trail and, keeping law up and running. So, when you get people like Andrea's parents and her son and her brother who may have some of the more severe symptoms, I hear a lot of fear out there, and I think that it's justified. And I'm very worried about people in our district.
Now, Amber, you're kind of on the other side of the pendulum or whatnot here. When we talk about like the Lincoln County, where I am, one hospital, county owned, so it's kind of a precarious situation. Where you are, it's on the flip. It's just a big medical monopoly that's kind of gotten hold up there. So what's that like?
Yeah, it's difficult here in the town that I live in. So I live in Sullivan County, and we had multiple hospitals here. And before, they were not allowed to have big mergers like what has happened with Valid Health. Some of the laws have been changed on the state level to allow this to happen. But in my town, we had Holston Valley Medical Center, which was a trauma level 1 hospital. And that serviced not only Northeast Tennessee, but that serviced Southwest Virginia as well. People who, it was the closest hospital for 3 hours for some of these residing or, surrounding counties for us. They lowered it down from a trauma level 1 to a trauma level 3. And last year, I have an infant. Well, she was an infant last year. She fell and she hit her head. And so we were 5 minutes away. We were out eating dinner when this happened. It was horrible. And we were 5 minutes away from Holston Valley. So when we got there, we were like freaking out. She was having seizures at this point. Like, it was so scary for me as a mom. I have a lot of kids, and this has never happened to me before. And so I didn't know what to expect. We waited there. They did a few tests there in the hospital, but it was literally just bare bones. There was hardly any staff there. There was very, very little emergency staff, period. We waited there for 2 hours on an ambulance to come pick us up, to take us 2 hours away from the hospital to Knoxville Children's Hospital to get her treated there, to make sure that there wasn't any massive brain bleeds or anything. She did end up having a fractured skull, and that was, even in acute situations, I know that, that's just one scenario, but there's many, many other scenarios that happen for people with, cardiac arrest, and time is crucial in those situations. But yet it took almost 4 hours for us to get help for a little baby. And thankfully she made it out just fine, and she is normal toddler now, but, it could have went south fast. And that's what's happened to several people. My district is over Johnson County as well, and they just have a community center out there, which I'm afraid is going to end up having to shut down because of this monopoly that's came in as well. And it's over an hour for them just to travel to get acute care at Johnson City Medical Center. So, it's really scary. They've taken out the birthing floors in the local hospital as well. And so even for me to give birth, I had to drive over 30 minutes away, and I almost gave birth in my car. So it was a very rapid labor, but, it affects it's affected me personally so many different times. I couldn't even imagine the overall effect that it has caused hurt for people.
So Gordon, the Tennessee Justice Center has a very great kind of overarching view across both metro areas and rural communities, all 3 grand divisions. So 2 things that I'm curious about to kind of start things. First, do these stories match up with what you and your team are hearing from across the state? And two, can you kind of give us just a higher level view of like how did we end up here?
Sure. Thanks, Chase. And sadly, these stories are very typical of the ones we hear from. We serve all 95 counties. We're a public interest law firm. We advocate for working people, low-income families, and the uninsured. One thing that struck me, Andrea, when you were talking about your mom having to be taken by helicopter, thinking, thank goodness for Medicare, because we haven't talked yet about the damaging, even devastating costs of healthcare. So if you're in a rural area and you don't have really strong insurance, if you have to be airlifted, I mean, we're talking tens of thousands of dollars just to get to where you can get the care. So we encounter the deficiencies in our healthcare policy in the state, both in terms of lives lost, lives diminished, and also in terms of financial disaster and financial insecurity. Because if you're uninsured or you're underinsured, and keep in mind that a lot of people that have a piece of plastic in their card are underinsured because there are gaps in what it covers. If you're in that boat and you get at all, if your infant falls and bangs her head, if you get COVID, you could be in really dire straits financially, and all that you've worked for your family can end up being destroyed by medical debt. So we see that across the state, but the situation in rural Tennessee is really in crisis, and that's a word that gets overworked, but it certainly applies here. We lead the country in the rate of rural hospital closings. Now, Texas, which is 6 times as big as us in terms of population, has a few more absolute numbers of hospital closings over the past decade than Tennessee. We're right behind them. But when you adjust for the population of the 2 states, we are by far the worst off of any state in the country. There are some things that we can point to explain that, but I would put at the top of the list our refusal to expand Medicaid. And that's a loaded issue because it's associated with Obamacare, and probably a majority of Tennesseans have a negative reaction when they hear Obamacare. Certainly a substantial number do. But the fact of the matter is, the better way to think of it, and the way to think of it in other red states, has been the Congress allocated a lot of money to pay for health care for Tennesseans, and our legislature won't let us have access to that. They speak in terms of the state budget, but it's federal money. Former Governor Haslam came up with a deal where the hospitals would have paid in a tax that would have covered the 10% that's the state cost. The rest is all federal. So it wouldn't cost our state anything to access this money. And we're one of a dwindling number of states. There are just referendums in Oklahoma and Missouri, both Republican-led states, where Republican leaders had blocked Medicaid expansion. And in those states, unlike Tennessee, they could have a ballot initiative where they could force the issue onto a ballot where voters got to decide. And in both cases, they decided, and that's part of a trend that's gone on for several years. Every time people, Republican or Democrat, have an opportunity to vote on this, they override the legislators that stand in the way. And the Nonpartisan Government Accountability Office, which is an arm of Congress, did a study 2 years ago looking at rural hospital closings, and it identified the single most important factor is whether the state expanded Medicaid. They cited a study which showed that in the minority of states that have not accepted the federal money and are therefore withholding that money from their hospitals, their doctors, their pharmacies, their working people, the risk of a hospital closing is 6 times greater, 6 times. So it's no accident that we're in the shape that we're in. And the tragic thing is we could turn that around with some different state policies. And I don't want to go on at too great a length, but I just want to make the point that a hospital closing is about more than where you go to get hospital care. I mean, as a number of folks have already said, the first hospital you go to, the one that's closest, may need to take you someplace else if you're requiring more advanced or sophisticated care. But even if you're in a rural community with a very small hospital with limited capacity, typically the rural hospital is the second largest employer in a county, right after the school district. Mm-hmm. Sometimes it's the largest. And so if you close the hospital, you are killing off a major source of jobs. And then there's a ripple effect because you can't recruit doctors because they don't have a place to put their patients. Mm-hmm. You lose the doctors, you lose the nurses. You can't sustain a local pharmacy. The local nursing home is unsafe because it can't hospitalize people locally when they get sick or they deteriorate. It sets off a terrible ripple effect. And as we've seen in a wide swath of West Tennessee, including sadly Haywood County, which was one of the first of the West Tennessee hospitals to close. There's been a study that shows if a rural hospital closes, it increases the financial pressure on other rural hospitals in that area, particularly if there are high rates of uninsurance, as there are in states where Medicaid has not been expanded. So that creates a domino effect. And so therefore, what you've seen in West Tennessee is exactly what the research predicted, which was you had the first hospital close, and then you see other ones in the area fall as well.
Yeah, so let's talk about that Medicaid expansion, because this is $1.4 billion a year, a little over $3 million a day. This is a lot of money that we're talking about. But when we talk about this Medicaid expansion, it's a very wonky term, right? It's not one that most people are familiar with on a day-to-day basis, even though we've been talking about this, it feels like for a decade, So I want to open it up to everybody here, just whoever wants to jump in first. How do you explain that kind of a wonky term to folks that haven't really thought about it before?
I hope you don't mind me jumping in. So how I explain it is like, I've been a server for many years. I've worked in the restaurant business since I was 18 years old, and I'm now 30. Okay. It helped me get through college. It helped me with a flexible schedule with taking care of kids as well. So, but with that being said, working in the restaurant work, I work with so many people who are uninsured. And how I explain it to people is that, right now under the Medicaid that we have in place, it only really insures adults that have children under the age of 18 or 19. And if you don't have kids and you work in retail, or you only work part-time, or you work in the restaurant business, or whatever, you're often not eligible for, or actually I don't think you're eligible at all for the Medicaid that we have in the state right now. With the expansion, it would cover those people. It would raise that bar a little higher and cover more people that were in a certain wage gap or wage bracket. But then it would also help people that don't have children to have insurance as well, and that can't get private insurance through their employer.
So with me being in the insurance industry, our agency became credentialed to offer the Affordable Care Act. We were the only ones in our county that did that. And so we would have people to come in. The ACA is set up where you have to have a certain level of income. If you live below what they call the poverty line, which was roughly maybe $17,000 plus, if you made less than that, you qualified for Medicaid based on ACA. So many of our clients that came in fell in that category because they're making minimum wage. They're working full time, but they're making minimum wage. And unfortunately, we were unable to offer them health insurance. And it was devastating to people because they should be able to afford it at this time. And other states that accepted the federal funds are taking care of their lower wage citizens in the area. But Tennessee still refuses to do that. And it's so upsetting to me because I really want to ask some of our legislators that block this, do they know people that are uninsured? Do you actually know people? Well, I do. And I see the devastation. Also, I am a licensed funeral director here. And I know of cases where people have chosen maybe not to pay utility bills to get their medication. And during the summers, that's not a good thing because you can die. So we have seen cases like that. And so it's real. And I think sometimes our legislators may not understand and can feel what other people are experiencing. And I just think that because it was the Affordable Care Act and people called it Obamacare, I think that's why they did not accept the federal funds. I would have people call my office because they knew we offered health insurance, and they would say to me, "Now look, I don't want that Obamacare. Now I don't want that Obamacare, but now I have diabetes and I have this, and I got to get me some insurance. I couldn't get insurance anywhere else, but don't give me that Obamacare." And I said, "Okay, well, what we offer is the Affordable Care Act." And they said, "Okay, I'll take that."
Yeah. You're exactly right.
So you know what? I wanted to help people. They just did not understand. And they were so happy to get the Affordable Care Act because they before could not afford health insurance, or they were automatically declined because of the strict laws of health insurance. You can be automatically declined for pre-existing conditions. But because of that, now people can be insured, but we just overlooked the least of these. We did not take care of the lower income people. And I think that's just terrible.
Well, I'll tell you, I can speak from personal experience for my youngest son. He lives in Kentucky, and he was working in the food industry, and his restaurant did not offer health care for the employees, and he was having a lot of health care issues. Mm-hmm. And he qualified for Medicaid expansion up there. And without it, he could not get very much needed medications that he has to take every day. Mm-hmm. And so grateful for it. Mm-hmm. And I think that Andrea had a point that when you just call it the Affordable Care Act, they're like, "Oh yeah, that I want." And it's like, yeah. Okay, you're not reading, so obviously you don't know it's the same thing. But I think that, well, I know that here in Tennessee, at least, one of our state senators said that they didn't want to discuss health care or health insurance because that was just a personal issue. Yeah, it's personal. People are dying. Mm-hmm. Mm-hmm. Very personal. And I think we have to discuss that because our people are dying because they can't afford to get health care.
That's right. That's right.
Yeah, and with everything, even as it is right now, some of the last polling that we've seen around this from Vanderbilt has Medicaid expansion at a 60% approval across the state. Gordon, from the research that the Tennessee Justice Center has done, when you see polls like that, do you have any idea why that isn't really translating into either higher support overall or just enough support to push the legislature?
I think when Governor Haslam made his big push to do a version of Medicaid expansion and it was rejected by his own party, I think lawmakers at that point just said, we don't want to have anything to do with this. There was a huge backlash. They understood that what they had done was extremely unpopular. They had done it pandering to a relatively small sliver of their own base, not representative of either the Republican Party as a whole or the Democratic, certainly Democrats or independents. And I think they figured, kind of like my mother said, Gordon, if you can't say anything nice about something, just don't talk about it. And I think they've decided that they're better off just trying to avoid the subject. I mean, it's noteworthy that Governor Lee, when the subject has been brought up, just says, I'm not talking about that. And that's kind of breathtaking to me, that in the midst of a pandemic where we've had thousands of people die and many thousands more financially ruined by this this disease, that we would continue to not just reject, but simply to refuse to talk about something that clearly the majority is concerned about. And the thing to emphasize about Medicaid expansion is that it's as important as it is to the 300,000 uninsured workers, low-wage workers who are out there right now facing this deadly illness without insurance. It's critical to the whole community. I mean, if in fact, and we know it is a fact because of the research, your hospital is 6 times more likely to close, it doesn't make any difference how well insured you are. If you don't have a hospital, and because you don't have a hospital within a few years, you don't have doctors, you don't have nurses, you don't have a local pharmacy, and your nursing home either closes or is not able to maintain the quality of care that's needed, it doesn't make any difference how great your insurance is. You're affected by that. And so this is extraordinary. And by the way, UT's Center for Business and Economic Research found that Medicaid expansion, that $1.4 billion a year, would generate 10,000 jobs, in addition to saving a lot of existing jobs. And that, again, in the middle of a terrible economic crisis, you would think that that this would be an automatic political winner, but it's not. Our feeling is, having tried to push this boulder up the hill for 5 years now, is that there will be a tipping point. And we hope it's soon, but there will be a tipping point that this just can't go on. I mean, every time another Republican state votes to do that, we become that, a dwindling minority. And at some point, I think it's going to dawn on people. And we know the business community supported it wholesale back when Governor Haslam made his unsuccessful try. And again, it was just pandering to a very small slice of the electorate, which is really unfortunate. They're entitled to their opinions, but I don't think they should be making health policy for the whole state.
Yeah, no, for me, it really came home a couple of weeks ago. I was talking to a farmer here about expansion and how other red states are doing it, either through ballot measures or sometimes you get lucky with the legislature. He mentioned that he saw Arkansas had expanded Medicaid. And he just kind of looked at me and he went, "We're behind Arkansas. Like, we're behind Arkansas. The only thing that it's acceptable, and even then it's a very small acceptable level here, is you let Arkansas win against the Vols every now and then, maybe once a decade, but that's the only time you're ever behind them." So yeah, we're seeing it kind of start sweeping through other red states, Missouri and Arkansas and Kentucky and the rest of them.
Kansas, Utah, Maine.
Mm-hmm. Yeah.
Nebraska.
Places that are staunch red states.
Right.
I just have to wonder, Chase and Gordon, if we did not provide health insurance for our legislators, how quickly they would be for Medicaid expansion.
Yeah, 5 years ago, when Governor Haslam was humiliated by his proposal being killed without even being brought to a vote in either chamber, it came out in the media that there was not just coverage for lawmakers paid for by taxpayers, but including taxpayers that were low-wage workers paying sales tax, which is, of course, the bulk of our taxes. But that they had lifetime coverage and they had coverage for their dependents. And the whole time they were talking about the government shouldn't be providing people coverage. When we put that out on our Facebook page, we would get comments, just people going crazy about that. We'd see a rebel flag, then we'd see a rainbow flag. I mean, you talk about an issue that brought people together. It didn't make any difference where you were on the political spectrum or what your views were on social issues. People thought this is simply not right. And again, I want to emphasize, we're not talking about them having to raise taxes to pay for this. We're talking about them standing in the door saying, you cannot access to a federal insurance benefit that you pay for with your federal insurance, your federal income tax.
Yep.
And people just, as soon as you explain that and you get past Obamacare, people shake their heads. And Andrea, I think with your ability to reframe it away from Obamacare, you need to come up with some way to have an event where there's a groundbreaking with people with a silver or gold shovels and a media opportunity to say this is some new economic development measure that's going to bring $1.4 billion. And actually, we've broken down the amount of money that would translate to on a county or district basis. And you could say, I'm going to bring in, if you elect me, I'm going to bring in this amount of money into our district, and it's going to translate into this many jobs. Because that's the truth. Unfortunately, we haven't figured out a way to use bulldozers and turn out a television crew for that sort of event. But that's the reality.
So we just have to find somewhere to rent a bulldozer now. I think
Right.
we can do that. So I want to take a break since we're about 30 minutes in here. For everyone that's watching right now, our discussion tonight has Gordy Bonneman from the Tennessee Justice Center, Amber Riddle running for State Senate District 4, Sheila Younglove running for State District 16, and then Andrea Bond Johnson running for State House District 82nd. We're talking about rural healthcare. If you've got questions for any of us, go ahead and pop those into the Facebook comment feed. We'll see those and we'll be able to answer those during the last half of the show here. Folks, while we're kind of giving everyone a chance to think about questions and things, I do want to ask that. So one of the big talking points that you have seen come out of our legislature this year, especially when they got a bunch of CARES funding and COVID funding, has been telemedicine and telehealth and how that's supposed to be the big new thing, right? So Sheila, we'll start with you. You know, when you hear that talking point come out, does it match up with what you're seeing and living through on a day-to-day basis there?
No. What I am seeing is that overwhelmingly, even the medical care providers are saying, you know, I can do only so much on a TV screen. There are times when I actually have to lay hands on a patient so I can, you know, assess their situation more. It's better than nothing, but it still is not something that the medical providers are happy with overall.
But Amber, it was enough of a reason for a special session this time around, right? So when your state reps and state senator was talking about it, any matching up with what you're seeing?
Yeah, so I agree with Sheila with it. You know, there's a lot of healthcare professionals that are, you know, they need their patients to be there in person. But what I have also encountered myself is that it has helped with some counseling. So some of my children, they go through some counseling sessions, and it has helped where we can't be in person and they can still receive some counseling through telehealth. And that has helped a lot. I'm not saying that I'm not discrediting anything that Sheila has said because I think she's spot on. But in some situations, I think that it has, helped a lot of people. And I think that it helped some professionals be able to reach out to their patients when they couldn't. There's a lot of places that are still closed down. And for minor, minor calls, I've had telehealth calls myself several times, just things that I shouldn't even have to go into the office for. I had a broken leg, earlier this year. My leg was broken. And I was in a wheelchair for several weeks until it healed. But, normally I would have to go into my doctor's office and they were like, well, how do you feel? There was no other testing that needed to be done, but they just wanted to know how I felt, and it could have been easily done through telehealth or over even a phone call. And if there was any other problems like, hey man, my leg is really hurting still, I think we need to get this checked out, then I could make an appointment and be seen in person. But it was costing a lot of money going in just to tell a doctor, I feel fine. My leg feels like it's healing. Or in certain cases like that too.
And I agree with you, Amber, on that. The thing that I was seeing was, yes, you have counseling sessions online, that's a great help. And I've noticed in some of the comments, people saying, well, it's been wonderful to have access to the telehealth. But you look at some of these counties, like some of the counties I have don't even have internet access. So it's difficult for them to even have telehealth appointments. So,
sorry.
Double-edged sword there.
That's exactly what I was getting ready to say, Sheila. In Haywood County, in our rural areas, broadband is an issue. Not everybody can access the internet, and even if you can, not everybody can afford the internet. So telehealth, I think it's okay. I know a lot of our major insurance carriers offer that as an option instead of having to come in. But people who are already struggling, they can't just pop on their computer or their laptop or their MacBook and access a doctor. No, that's not being realistic. People are having hard times keeping their lights on. People are having hard times even buying the medicine that they need to live. So no, we have to just, I think people may be slightly out of touch with reality when it comes to people that are making minimum wage. And so it's not that easy. I remember when I was running 2 years ago, someone said, well, if somebody doesn't have health insurance, all they need to do is just go to the emergency room and get help. Well, okay. And then you will get a gigantic medical bill that you cannot afford. Then you will possibly have to file for bankruptcy. Who wants to have an additional medical bill? I have heard of people being sick and refusing to allow the ambulance to take them because they didn't have any money. They did not have the insurance. So we got to get in touch with all of our citizens in Tennessee and try to figure out how we can help all people.
Yeah, I totally agree with you on that. Broadband is a huge issue, and not reaching out to some of our rural areas. And like in some of my counties, we don't have internet to some of those. And I feel like that's where telehealth can sometimes be used with phone calls as well too for minor cases. But yeah, I completely agree with you. And being able to reach out to everyone and not exclude a whole group of people is important.
I think it should be a question of not either broadband or accessing the federal dollars, giving people financial security, bringing federal dollars into the local rural health system and keeping our hospitals and infrastructure going, or broadband. It shouldn't be either or, it should be both and. There's no question that telehealth is a positive, but it kind of is crazy when you think about it, that you would answer a situation like Amber's child falling or Andrea's mother being in a life-threatening situation by suggesting that telehealth is the answer for that.
Mm-hmm.
It's clearly not. And, you know, we can and we should do telehealth and provide access to the support that people need. You know, they even have telehealth in Arkansas.
Oh.
Poor Arkansas, man. Poor Arkansas.
But they somehow managed to do both and, not either or.
Yeah.
Wow. There's an amazing
I think that's the big thing, right? So one of the things that's come out of the pandemic has been, it's made very clear where our priorities are and where, where we're not living up to our promise of, making Tennessee work for every family, no matter their age or health or economic status or anything else. It's all intertwined. I remember I was watching a Tennessee Justice Center event, and I forget who the speaker was, but they were talking about this fantastic speech that Martin Luther King Jr. gave about the tapestry and how we're all woven together, and what happens to you happens to me, and what happens to me happens to you. And that's how this is, especially during a pandemic, because you take one little part out of any of this, right? You take your hospital from a trauma 1 to a trauma 3, or you cut your funding for nursing home beds, or you cut your funding for ambulances, or you end up with a school that needs to go virtual but can't because they don't have broadband through the entire county. All of it just ties back together, and I think that's one of the things that can be really, really hard for our state leaders to do, is to see how everything links up like that, and how you have to look at the big picture and how all of it ties back down. Where we were kind of, when I was listening through that, Gordon, since the Justice Center does deal with so many families across the state, what's it been like? What are you hearing from them when they're offered, just do telehealth when you need to do this? Or have you seen any assistance giving out to kind of help with the broadband issue? Because it's kind of hard to have a video chat with your doctor if you don't have a computer, for instance.
Well, I had somebody say to me, well, that's kind of like telling me when I have a stroke to put my hand on the television set. I mean, as Sheila was saying, it's fine as far as it goes, but you need a health professional on the end of the line. And if you need actual care as opposed to just your leg is coming along okay, you don't need to come in for an X-ray, that needs to be in your community rather than a helicopter flight away.
Right.
Yeah. So I want to wrap things up just by talking some very concrete actions here. That's one of the big things, whenever I've been part of different discussions like this, or you watch a live stream with panels and things, I think everyone always does a really good job of laying out, here's what the situation is, here's some possible answers that we could do. But from an audience view, from just watching it, it's always tough to know, okay, all those folks did a great job outlining the issue. What do I do now? So I just want to open it up again to everyone here. What is a next step that somebody should do? When they wake up tomorrow, or have some extra time this weekend, what's some concrete actions that people can take to, whether it's supporting Medicaid expansion or making their own community healthcare better? What's some action that we can give to people?
Well, Chase, I'll just jump in and make a shameless plug of self-promotion, which is come to the Justice Center, Tennessee Justice Center website. You'll see all sorts of resources and a way to connect if rural health matters to you. And we can get you involved on a nonpartisan basis, everything from sending an email to a legislator, to showing up for an event, writing a letter to the editor, which is, we probably all know, really makes a difference. There's just telling your story. In our experience, nothing preaches like a personal story. And, that was true 2,000 years ago when Jesus wanted to teach people to use stories. And particularly when we're so divided, what we found is that as humans, we learn from stories, we identify with others through stories, and that will cut through a lot of the ideological and political stuff. And we've had tremendous volunteers of both parties who've been willing to stand up and tell their stories, sometimes with great courage, sometimes with great passion. And I think that's what will finally tip this boulder over the hill. I'm optimistic. I think Tennesseans care about each other. They care about their community. And I think that we simply haven't had public policy that reflects our values for several years now in this area. And so if that concerns you, please connect with Tennessee Justice Center, and we'll put you to work.
Absolutely.
I agree with what Gordon said, and what people can do now is prepare and plan to vote for those that will have their best interest at heart. Vote for those that will put the people over politics. So be prepared when early voting happens in October 14th. Go to the poll and vote like your life depends on it, because it does. You want to have a representative that believes all people should have access to affordable, quality health care. All people deserve that. And if your representative is not doing that, it's time to get you a new one.
Yeah, absolutely.
Yeah, I think that's one of the things folks forget is that they all work for us. Doesn't matter if it's a state senate, state house, anybody over the executive branch from Governor Lee always down, all the way down. We're not customers, we're the employers here. Right. So, Sheila, Amber, anything else you want to throw in before we wrap things up?
Well, I was just going to comment a little bit more on what Gordon said, about contacting people. Tennessee Justice Center has the premium information of anything you would want on this subject and many others. But I think that once you take that information and you call your representatives, you call your senators, and you call your governor, email them, blow their phones up and say, hey, you work for me, and this is what I want. I want affordable health care. I want Medicaid expansion. And I think that you get their attention when you do that, because if they're not going to get your vote, they're going to do something. And, I agree with Chase. They work for us. It's not the other way around. And they need to be reminded of that.
Yeah, I don't have anything else to add to that except for, I agree. Blow them up. Emails, phone calls. I know sometimes you can't get a hold of them through phone calls, but emails, I've emailed even the guy that I'm running against over a few things, and he's emailed me straight back, and that's important. Let them know what you want. If they don't hear your voice enough, they're not gonna listen.
Yeah, I don't want to steal a line from any well-known newspaper or anything, but democracy dies in darkness, and that's what happens at a state level every time. All right, thanks again for to each of you so much for being here tonight. Thanks to all of you watching. If you want to find out more on what's going on in rural Tennessee, I'm going to make a shameless plug, just like Gordon did. What you want to check out is ruraltndems.org. That's our caucus website. You can also head over to Facebook and find us there as well. Thanks again for everybody that watched, and to all of our great organizers, candidates, and experts. Y'all have a fantastic evening.
Thank you.
Thank you.
Thank you.